This multivitamin and iron product is used to address vitamin deficiency caused by inadequate diet, certain illnesses, or pregnancy. Vitamins and iron are essential for the body and are vital for maintaining good health. It is important to take this medication as prescribed by your healthcare provider. The recommended daily dosage is 1 tablet, usually taken with a meal. It is best to take this medication at the same time each day to help you remember. When taking ABC Complete Women's 18 mg, 400 mg tablet multivitamins, it is best to take it by mouth, usually once daily or as directed by your doctor. Take with a full glass of water, unless directed otherwise. It is recommended to take this medication on an empty stomach, 1 hour before or 2 hours after meals. If you experience stomach upset, you may take this medication with food. Avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication to ensure its effectiveness. Remember to not lie down for at least 10 minutes after taking the tablets or capsules. If you are taking the delayed release form or extended release capsules, swallow them whole and do not crush or chew them. It's important to take this medication regularly at the same time each day to get the most benefit from it. Some common side effects of ABC Complete Women's 18 mg, 400 mg tablet multivitamins include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body adjusts to the medication. If these effects persist or worsen, it's important to contact your doctor or pharmacist promptly. You may also notice that the iron in this medication causes your stools to turn black, but this is not harmful. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects that are not listed, be sure to contact your doctor or pharmacist. As for the best time to take this medication, it's important to follow your doctor's instructions. Typically, multivitamins are taken once a day with a meal to help with absorption. If you experience any side effects, you can report them to the FDA in the US or Health Canada in Canada. It's important to keep ABC Complete Women's 18 mg, 400 mg tablet multivitamins out of reach of children, as accidental overdose of iron-containing products can be fatal in children younger than 6 years. If overdose does occur, seek medical help immediately or contact a poison control center. Before you start taking ABC Complete Women's 18 mg, 400 mg tablet multivitamins, make sure to let your doctor or pharmacist know if you have any allergies to its ingredients, or if you have a medical history of iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin contains folic acid, be sure to inform your doctor if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency. It's important to consult your doctor for details, as untreated vitamin B12 deficiency may result in serious nerve problems. Before undergoing any surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this medication. It's important to be aware of any potential drug interactions when taking ABC Complete Women's 18 mg, 400 mg tablet multivitamins. This product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to separate your doses of these medications as far as possible from your doses of this product and ask your doctor or pharmacist about finding a dosing schedule that will work with all your medications. If your multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. Additionally, this medication may interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this drug. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the US, you can contact your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has recommended ABC Complete Women's 18 mg, 400 mg tablet multivitamins, it's important to follow their instructions and not share the medication with others. It's important to keep all medical and lab appointments while taking this medication. Some brands of this multivitamin may also contain additional ingredients such as docusate. If you have any questions about the specific ingredients in your brand, be sure to ask your doctor or pharmacist for clarification. It's essential to remember that this product is not a replacement for a healthy diet. It's best to get your vitamins and minerals from a well-balanced diet and to follow any dietary guidelines provided by your doctor. If you are taking this product as directed and forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. When storing ABC Complete Women's 18 mg, 400 mg tablet multivitamins, make sure to keep it at room temperature and away from light and moisture. It's important to not store it in the bathroom, and to keep it out of reach of children and pets. When you no longer need the product or it has expired, make sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. It's best to consult with your pharmacist or local waste disposal company for the proper way to dispose of the product. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.